Hello, my name is Jill, and this activity will discuss musculoskeletal and neurological assessment findings on a virtual patient named Tina. This discussion will include what is essential to a focus on in an end of shift report for Tina regarding her musculoskeletal and neurological assessment findings. I will review what would be a priority in the musculoskeletal and neurological assessment if I face time constraints. This video will consider 3 patient health promotional opportunities for a musculoskeletal and neurological assessment. Tina has a foot injury that, coupled with her diabetes, has been slow to heal. Tina's musculoskeletal assessment includes her complaints of 6 out of 10 pain that increases when she puts weight on her right foot. Tina's foot pain affects her mobility and puts her at risk for falling. The foot wound and associated pain have changed the way she walks and showers and has affected her emotional health because she does not like this decrease in activity. Tina has a decreased range of motion in her right ankle and has swelling to her right lower leg and foot. Tina displays some weakness in her right leg as well. When reporting on Tina's musculoskeletal assessment findings to the next shift, it is essential that she is at high risk of falls and had a fall last week. Tina's pain, medications given for pain, and effectiveness would be reported. Tina's abnormal assessment findings, such as a decreased range of motion and increased weakness in her right ankle, are essential for the oncoming nurse to know. If I were doing a musculoskeletal assessment that was limited by time, I would ask general questions. I would ask someone about any history or present problems with muscles, bones, or joints. I would assess someone's movement, extremity, color, and temperature. I would start at the feet and work my way up. I would ask about pain and range of motion issues, as well as family history. Fall risk prevention is one health promotion opportunity related to musculoskeletal assessment findings. Fall risk education is an inexpensive strategy that helps reduce fall risk. Another educational strategy I would use is energy conservation related to surgical procedures such as a knee replacement. This teaching will help patients gain what is necessary from physical therapy without overdoing it and having such setbacks. The last educational opportunity would be pain control. According to research by Pillison and others in 2020, muscle pain is a major factor in disabilities worldwide. Pain management is essential in keeping people functioning at their highest potential with the least amount of pain. Tina's neurological assessment finds Tina to have neuropathy and decreased sensation to her feet. She is also unsteady balance and hesitant gait secondary to her foot wound. Other than this, her assessment is within normal limits. It would be essential to report to the oncoming nurse that Tina has unsteady gait associated with her foot wound and neuropathy due to her diabetes. It is also essential to include that Tina is awake, alert, and oriented ×4 and is otherwise neurologically intact. A neuro assessment under time constraints would consist of testing sensation to the most distal parts of someone's hands and legs, determining cognition, and assessing the patient's response to other questions that would be asked for an assessment, such as, "Why are you here?" Watching how someone walks and carries themselves is also helpful in doing speedy assessments to determine if someone is neurologically intact. One health promotion for neuro disorders is for peripheral neuropathy. Educating on using proper footwear and performing daily foot exams using mirror if needed is crucial. Another educational opportunity would be teaching at-risk populations the FAST tool for stroke. FAST stands for face, arm, speech, and time. This population would teach that a facial droop, weakness on one's arm or side, slurred speech, or difficulty speaking would be warning signs of a stroke, and that the quicker it is diagnosed, the better the prognosis. The third education point for families who have a loved one with dementia. Dealing with dementia can be difficult for families because their once loving loved one can become a different person. Teaching family to be sensitive and patient with these loved ones will be vital in dealing successfully with their loved one's diagnosis. In conclusion, Tina's musculoskeletal assessment includes that she is a fall risk, and it is imperative to include that on an outgoing shift report. A quick focused musculoskeletal assessment would include an assessment of history and visual observations. Fall prevention, energy conservation, and pain control are three teaching points for musculoskeletal assessment. Tina's neuroassessment includes her peripheral neuropathy, and that would be important to disclose to the oncoming nurse along with her cognition. A quick, focused assessment would include observing the patient walking and how they carry themselves and other visual assessments. Three teaching points for a neuro patient would include foot care for neuropathy, fast treatment with a stroke, and how family members should handle a family member with dementia.